Welcome back everybody, David here again with Med School Bootcamp. So in this next video, we're now going to talk about a particular type of stone called ammonium magnesium phosphate, sometimes also called struvite stones. So we're going to touch on the really high yield things that you all need to know in order to get your questions right on test day. So the first thing I really want you to be mindful of, when we look at the pathophysiology here, we say that this is most commonly associated with urease positive infections. So as you can see, here's a whole list of common bugs that are urease positive. So what do I mean by that? What does urease positive do? Well, a urease positive bug is able to convert urea into ammonia. This ammonia can pick up a proton, becoming ammonium and creating an alkaline urine environment or an elevated pH. This environment is what allows for stone formation. So if we draw our attention to the image here below, we can walk through these steps and we can see that our bacteria molecules right here are essentially able to adhere to the urothelium. The presence of an enzyme called urease allows this particular bacteria to break down the ammonia and ultimately create an alkaline environment. This is important because if we look at our next step, we see that these bacteria are also able to create an environment that allows them to become sticky in a sense or congregate in the area. And this alkaline environment is really what allows for stone formation or for stones to precipitate. Ultimately what happens is that these bacteria can then kind of break off or go to other portions upstream in the kidney. And because they create something called a biofilm, they're able to form what's known as struvite stones, sometimes also called staghorn calculi. And this is a bit of a buzzword. If they mention staghorn calculi, they're almost always talking about struvite stones. And to finish out this process, we can see that struvite stones contain ammonium magnesium phosphate crystals, which are bound together by a biofilm that is released by the bacteria. This is particularly important because this is a very unique finding. To get this essentially massive size of a stone in the kidney is fairly unique to struvite stones. It should make sense then that the precipitation of these stones includes an increased pH or an alkaline environment, because we said that the bacteria's ability to use the enzyme urease to convert urea into ammonia, which can ultimately pick up a proton and become ammonium, is creating an alkaline environment or an elevated pH. It's also important to know how we would work up these patients, and particularly the imaging. And for this particular type of stone, if we consider the diagnostics, we see that both an X-ray and a CT scan is going to show a radio-opaque stone. That is to say, the structure of the stone is able to resist the imaging rays, and they should appear light on our CT or our X-ray. This is helpful information for us because if we look at our image over here in the corner, we see this really white stone. This is our characteristic staghorn calculi, which is massive, taking up most of the kidney, and this is what they mean when they say the stone is radiopaque. Notably, it's also important to keep track of what the crystals look like on a urinalysis, and here they have a rectangular prism, sometimes also called a coffin lid appearance. The reason this is so important is because each individual stone has a very unique or characteristic shape, and so by knowing what shape is associated with each particular stone, this helps you with your differential diagnosis. When we think about management options for this condition, it's really important that we start by treating the underlying infection, right? We said this is typically due to urease positive infections, and we gave a whole list of options up here. However, there are even more to choose from. So that is to say, this is typically due to a urinary tract infection. And so antibiotics are going to be a mainstay treatment for a urinary tract infection. It's also important to note that these stones can be massive. Remember this picture over here. This is a huge calculi in the renal system. And so this is not a stone that is feasible to be passed. We're not going to pass this stone. It's so big that it likely would need surgical intervention or surgical removal. Typically, as with most things, right, we always want to start with conservative measures. So remember in the last video, the overview, we talked about some kind of general things that you can do, right? Hydration, a low sodium diet, and why those could be helpful for patients. But here, if the stone becomes so big that it's wedged into the kidney itself, we're not going to pass this through the ureter, right? There's not enough space to do so. And so this is a scenario where surgical intervention can be indicated. So just as a quick summary for this video, the key things I want you to keep in mind here is that urease positive infections are going to be the big association here, right? A UTI, a urease positive infection, they likely will expect you to know which infections are urease positive. I've listed some of the really high yield ones here on this slide for you. And the reason urease positive infections can cause this is that they create an alkaline environment, which is a more favorable environment for stone formation. When we think about our diagnostics, we're going to be looking at some imaging studies, including X-rays or CTs, and these are radiopaque stones. We would also likely get a urinalysis, which can show us things like hematuria, we talked about in the previous video, as well as a particular shape. and these particular stones are shaped in a rectangular prism appearance, sometimes also referred to as a coffin lid. And finally, the treatment here is going to involve all of the classic things we talked about on the previous slide, kind of our general pain management, modalities, increasing our hydration and fluid levels. But ultimately, if these stones get so big that they look like this, it's not going to pass through the ureter, and surgical intervention might be indicated.